For the first time in months, most of the Triad is seeing high community spread of COVID. The CDC is suggesting people who live in any of the orange counties start wearing masks again. To help you make sense of the data and everything going on with the pandemic right now, we have Dr. Cynthia Snider from Cone Health here today. She is an infectious disease expert who can talk about all things COVID. Dr. Snider, thanks so much for being here today. The first question I want to ask you, are you surprised when you see that the community levels for transmission have gone up?
No, I'm not surprised. You know, this new, the subvariant of the Omicron BA.5 has been steadily increasing in many cities and countries throughout the world. And it tends to be, it's morphed into this very, I think, contagious virus, and even more so than the original Omicron that we saw beginning of the year.
So you kind of hear two things when we have been hearing about this new subvariant. One, it's more contagious, but two, it doesn't seem to be as deadly. Is that correct?
Correct. So the key thing of that, we have to consider that a majority of the population has either been vaccinated or has had natural infection, maybe even once or twice already. But the concern is that even if you've had like COVID illness, even the beginning of this year or even in the springtime, we realize that that's not going to give you enough protection against BA.5.
How many times can a person be infected? I mean, is there really just no answer to that?
I don't think there's an answer to that. You know, we have seen people reported that they've had like at least their third bouts of illness from it.
One thing that is important to talk about whenever we're talking about COVID is vaccines. As we know, children as young as 6 months old can get a vaccine. What can you tell parents who might be hesitant about getting their young children a vaccine?
I would say that, you know, the vaccine right now has been tested in clinical trials. They haven't seen like untoward effects and that we were concerned with, like myocarditis. And this is a really good time to get your child vaccinated, especially as we head into the end of summer and the start of the school year.
With all of these different COVID-19 variants popping up, you know, how often are these variants kind of changing themselves and being something that is a little bit more than the previous one?
So I think from the infectious disease standpoint, the circulating virus that we're seeing now is very fit. You know, it's doing this aspect where it's causing like immune escape. So some of the antibodies that we've developed from either the vaccine or natural infection, I would say confers some immunity to getting reinfected, but we're still seeing some reinfections. The key thing is that we're not seeing people as severely ill, so they're not requiring it to be hospitalized. But our main concern is that, you know, if we don't take protective measures, hospitalizations rates are trending up. And then eventually that statistics of seeing more people hospitalized and more people being admitted to the ICU will eventually happen. So in our community, we do know that a lot of people did take that primary series, but people still are not up to date on their second. You know, if you're over 50, you should probably have had 4 shots, you know, and not many people have done that. So this is a great time to get up to date on your vaccines and your boosters in order to protect yourself from severe disease, as well as any like long-term like sequelae from COVID illness itself.
You'd mentioned for people over 50 that you probably should have had 4 shots by now. What really is the difference between getting 3 shots and 4?
It really also, a part of it depends on when you have had your last booster dose. Some of the recent studies should suggest that we know that people who've been boosted definitely have a decreased mortality with COVID for severe illness and COVID illness. So I believe there's a 4 times difference in mortality rate when they've looked at bigger data sets. And when you compare somebody that's only had primary series to people who've been boosted, there's been, I believe, like I think you compare 86 to 99% difference. So the key thing right now is that we have so many tools at hand. Right when you started this segment, we talked about indoor masking, and really consider using the KN95 masks, especially as people go back to school and in their workplace if possible, even though they don't require it. And then this is a great opportunity to also, those who are immunocompromised, who have risk of severe illness, who are greater than 50 years old, that is a good time to get your second booster.
During much of the pandemic, we had been hearing that, after you've been infected with COVID, you had about 90 days. Would you say that that's still accurate?
I would say that it does give you a little bit of window, but I think what we're seeing now is that folks who've been reinfected or who've been boosted and then get an infection, that their symptoms tend to be flu-like illness. And I would say still not to dismiss if you're having nasal congestion and thinking it's a typical cold. Still, the mindset should be, I need to think to make sure this is not COVID illness and get tested.
Okay, Dr. Snider, one segment down, two more to go. We appreciate your time. And she's going to be here for the next 20 minutes or so answering any of your questions COVID related. So feel free to text them to us at 336-379-5775, and we will be right back.